Hi, everybody, and welcome back to yet another cracking installment of the Matt Brown Show. This is the Built in Texas series. And if you haven't been following along, this is where we are connecting you to amazing founders just changing the way, well, changing the world for the better, actually. It's probably better said that way. But with me on the line is none other than Tom Vo, the founder and CEO of a health tech company doing incredible things called Nutex Health. Welcome to the show.
Thank you, Matt.
So, Tom, yeah, Matt, it's privilege is all mine. I think you do something really interesting, which I'm super excited to share with the world. So Tom, I always ask our founders, like, what's your background? Because I think that's a really important thing. And then if you could paint a picture of what that is, and then give us some context around the origin story for what you are doing at NUTX Health.
Yeah, so my background is that I'm actually an immigrant from Vietnam. Came to the U.S. when I was about 11 years old. And we actually came to Michigan and Ohio and grew up there. And that was where I did my training, medical school, and residency, and so on and so forth. But when I finished with schooling, I came down to Houston and worked at a very big hospital down here in Houston. And at that time, this was maybe about 12 years ago. And you may know, I don't know if you know Houston or not, but Houston is a humongous city. It's like the size of Connecticut. And I used to work in a place, it's called the Medical Center, the largest medical center in the world. It's in Houston. But what I found was that people from around Houston used to drive an hour and a half to get to the medical center to be seen by a physician. And at that time, a thought popped into my head: why do these patients have to drive all that way, park in a garage, pay $10, and then go wait in the ER for 6 hours to be seen? And so at that time, we basically came up with an idea to instead of bringing the patient to the hospital, let's bring the hospital to the patient and increase access to the patient and bring a doctor there and have the patient be seen there so that they don't have to waste their time spending all that time in traffic and pay $10 to park in the garage. And so at that time, we launched our first facility here in Houston. And then from there, we then expanded throughout Houston. And then from there, expanded throughout Texas to Dallas, Austin, places like that. And then from there, we expanded throughout the country. So now we have 22 facilities in 9 states. And the whole purpose is to expand access for patients so that if they have a medical emergency, they're able to see us faster and be on their way, and with much less discomfort than going to a much bigger hospital system that may or may not treat them as well as we do. So that's basically the product.
Okay, interesting stuff. So this is like a distributed micro hospital concept, right? Well, it's not even a concept. You've actually got some kind of scale, which we'll get into in a moment. But what's the issue here? I mean, what's wrong with just, I know the parking thing, but like what's the fundamental issue around
Yeah,
traditional healthcare?
yeah. The fundamental issue is that there are too many patients and not enough providers. That's the fundamental issue. And so we're just trying to sort of like, I mean, we're not trying to solve that issue. We're just trying to make it better and plug some of the holes. And right now, around the country, and especially with the flu, COVID as an example, hospital emergency rooms are inundated with patients. That's basically the fact. And our goal really is just to help decompress some of that hospital system so that we could treat, some of the patients, and so not have them, wait so long. And so that's the fundamental, issue is that the hospitals are just overwhelmed. And it's just not in the US, but if you read, horror stories in the UK, maybe even Australia, maybe in South Africa, there's just not enough facilities to treat all the patients. So that's the first issue. Second issue is that we have a problem with getting healthcare workers to stay in their field right now. There's a mass exodus of healthcare workers, and I don't blame them. I mean, during COVID, they put their lives in danger going out there to treat patients. And we know a lot of our healthcare workers who actually came down with COVID, and unfortunately, some of them have passed away from COVID. And so, unfortunately, it's just a part of the job. And so there's a massive need for healthcare workers out there. And so that just put more strain on the healthcare system as a whole. so that when the patient comes, even though even if there is beds available, there's not enough workers to take care of them. And so that's just put additional strain on, on the whole entire issue of the need that we have, at least in America, but we know this is a worldwide issue.
Mm. Yeah, I went to Greece to help my sister out. Just a personal story. So she was there with her boyfriend at the time, and they were in like a head-on collision, and it was a
Oh
whole
my,
thing. Yeah, it was bad, dude. And eventually, I got the call from my sister, and my sister's like always been there for me in my entire life. So I'm there. Like, just don't worry, I'm coming. So I went over there, and there was an issue with the health insurance. Like, she paid for travel insurance, like a premium travel insurance, and it was a Friday night, and because of the time difference from Greece to Paris, where they were contracted, the office had closed. So she couldn't get pre-approval, and then the private hospitals in Athens were like, "No, dude, we're not taking, this guy or Chris in because we need pre-approval from the insurance company." And the insurance company wasn't available. So what happened was they transferred him to a government hospital, and it was a Friday night in Athens. Tom, I've never in my life seen such a horror show when it comes to an overwhelming amount of patients and not enough staff.
right,
It was insane. It was literally the definition of insanity. And I remember there was this Indian chap who had injured himself in a construction site, walked in, him and his two buddies, into the ER. They put him onto a bed after he was standing around for like half an hour waiting for a bed, and eventually he gets put onto a bed, and he gets completely ignored for like hours, to a point where he actually gets up and walks out of the ER with like wound in his head. You know what I mean? Like, it was just
right,
next level insanity. I've never in my life seen something like that. And like, because like they drive around like they do in Colorado, like with no helmets. So you have like five family members on one bike.
right,
You know what
right.
I mean? Like, it's crazy. But that's I know what you mean. Like when when you say like what it means to be overwhelmed and the impact on patients. Like I've had a personal story, and I wanted to share that with you. So so I'm on the same page as you. It sucks, man. If you don't get the right help, it's a real problem. So what's the size of this market opportunity, Tom? Like, have you done crunched the numbers to look at, well, in the context of what we're talking about, what's the market opportunity in dollars, would you suggest, roughly?
Well, I don't know the exact dollar amount, but it's humongous. So we're just talking the U.S. alone. There's 50 states, right? And in every city, there needs to be healthcare. So that emergency, that motorcycle crash, that fall, that car accident that your sister involved in, somebody's got to be the safety net for those, 24/7, right? And so it's a humongous, need out there. It's a humongous market. Unfortunately, I don't have the exact numbers, but whatever number it is, if I tell you a number, it'll be just one number. But the point is that, it's a humongous need, and personal stories like that, I hear that pretty much every day about the massive amount of patients that are in waiting room. And the honest truth is that, a lot of time these patients, since they're waiting so long, they either die or they walk away. They get better and they go home, just like that chap that fell during the construction worker. And so that's not a good way to treat patients, right? And so there's a humongous need, and one of the reasons that we're expanding so much, and by the way, we have at least 20 more locations that are coming up. One of the reasons that we're expanding so much is we have, physicians around the country calling us up and asking us to help them open up a hospital to alleviate the need like that, to prevent that child from walking out and, die on the street. And so that's why, we're just so passionate about what we're doing, simply because we have a real opportunity here to create a brand new paradigm of healthcare and help, as many people as we can.
Yeah. What's the dollar value of your life? you know
Exactly. there's no, but it's infinite. It's infinite. That's right.
yeah, exactly. And so why did you decide to solve this one? Like, you know what I mean? Like, were you? I know you were working in hospitals and so forth, but like, what was the springboard that led to this idea of a micro hospital, quote unquote?
Well, I mean, I think it was sort of like the right moment at the right time. Everything sort of came together. It was sort of like a luck, sort of. And, there was an opportunity. And I've always sort of like been a physician, but also an entrepreneur at heart. And so, that was when we took the leap and knock on wood, we got very lucky and got very successful. And then from there, we just built on to our success, and every single dime that we made from these hospital, we invest in the next, venture. And so, that's basically, how we did it. Just one hospital at a time, slowly, and then continue growing. And then we're still continuing to grow, sort of like that now, except the only difference now is that we're a public company. And so it makes growth slightly easier than being a private company, putting all these savings into, our hospital, because now we have some, institutions backing us. Right. And so, but it's the same concept, it's the same passion, it's the same, business plan, it's the same growth trajectory. We just have, a little bit more, regulations, and we have a little bit more, people, looking, watching at us from before when we were a private company.
Mm-hmm. So, what does the patient experience look like? If you say micro, what does that mean? When you say, like, are you talking about like 5 beds, 50 beds? Like, how big is it when you say micro? Because micro means micro. Am I getting like micro attention and micro care too? Like, how does that experience play out in your business?
Well, no, I mean, our hospital is actually very well efficient and well run. And so that chap that you mentioned that had a construction accident, had he come to our hospital, he probably would not encounter a room full of patients. He probably would have been seen and triaged, seen, and probably treated within like an hour. He probably would have waited like 15 minutes and got in, right? I guess your sister's, I don't know, boyfriend or fiance, he probably would have been in right away and seen him, and we probably would have done the necessary treat up and X-rays and diagnostic to make sure that he didn't have any serious injury. And if he did have a serious injury, then we would then transfer him to a much bigger hospital. And so the point is that we're much smaller. We're located in areas where there's a need, and we have physicians and nurses that are sort of like all aligned to take care of that patient. Because the other issue is that that hospital increase, there's a good chance that the physicians and nurses there are not don't have any what we call skin in the game. And so if the patient sits and wait 5 hours, they don't really care. It doesn't matter, right? But for our hospital, our physicians, our nurses, I mean, a lot, I mean, they have skin in the game. And some of them have a stock ownership, some of them have a personal investment in the hospital, and so they're going to go the extra mile to make sure that that patient on the backboard is seen quickly, taken care of, and dispo appropriately. And they're going to go the extra mile to do that.
So, Tom, this is obviously, as you mentioned to me, like you cannot cope with the demand, in fact. And you've scaled this really quickly. So just paint a picture for our audience around the world, like how many locations do you have hospitals in currently?
So right now we have 22 locations in 8 states. Right now we're just in the US. I mean, there's plenty of work in the US alone. But we have about 20 to 25 projects that are either under construction or in very deep development in another, I think, 6 states. So in about 2 years, we're going to be in 14 states. And we're probably going to have around 40 locations in about 2-3 years.
That's amazing. So what kind of scale are you trying to get to?
Well, I mean, I think that, I've always tell, my staff and our investors that eventually we want to get to about 100 locations. Right now we're at 22. So maybe 5 times the growth in the next 10 years or so. Mm-hmm. So, but even at that scale, it's still very small. So, I mean, as you know, the US has 50 states. So we have 100 locations, average 2 per state, which is nothing, right? Nothing. In fact, we could probably put 2 of them in Denver right now, if we want to. So the point is that even at 100 locations, which to me seems like a lot, but if you put that in the whole context of being in the U.S., it's a very small scale. But having said that, I think that even at 100, it's still a lot of value to a lot of people, because the hospital there, even though it's a small hospital, there's a lot of things you could do. I mean, obviously everything goes through the front door with the emergency room, but we have inpatient beds. You can do procedures there. And remember, the other thing is that we have a massive behavioral health issue with people with depression and anxiety and alcohol abuse and all that stuff. We're starting to treat a lot of those in our small little hospital, because there's just not enough like behavioral or psychiatric hospitals. So a lot of those come to us, and so we have to learn how to treat them. And we've come up with some pretty sort of like innovative stuff to treat patients with interventional psychiatry, involving telemedicine as an example. So my point is that think of the hospital as sort of like the car. Once you have it, you can take the car in many different directions and to do a lot of good for patient, and just basically take care of pretty much whatever is out there that needs to be taken care of. And whatever we can, then obviously we will refer to a much bigger hospital system.
So how long does it actually take to set up a hospital? Let's just say here in Denver, you find a location, and finding the doctors, setting up the infrastructure, setting up the systems. I mean, creating a hospital is pretty complicated, I would imagine. Just even from like a regulatory compliance perspective, and systems and training and onboarding and getting the whole thing to work. It's not exactly, it's not like turning on a car. I wish it was, but it's not. So how long does it take, like from day one to day of operation, where you open the doors? How long does that typically take?
I would say about 18 months. So let's just say we want to open in Denver, which we have looked in Denver before. It's a great market, by the way. So let's just we find a piece of land in Denver. And by the way, most of the time we have to build from the ground up, because most of these hospitals, micro hospitals, just don't exist, because nobody's ever done them before. And so we're doing it. And so it's not like buying a house where you get to go out there and buy an existing house. It's not like that with micro hospitals, because they don't exist anywhere. And so most of the time you have to build from the ground up. Now, having said that, we have acquired, some other hospitals before. And so of our 21 locations, we probably acquired 6 of them. But the majority we built from the ground up. But let's just say it is from the ground up. It's about a year and a half to 2 years to basically go from ground to build it up, and then assemble, and then put all the equipments in there, and then assemble a team of doctors and nurses to run. And so, no, you're right. It is very regulated. It's a very complicated process. And not only that, the people that works in the hospital, I mean, you can't, it's not like Starbucks, where you could just go out and hire, somebody and make coffee. The people that works in there are basically degree people. You have to it's a very specific type of training that you have to have. So doctors, nurses, radiology techs, people like that. And so, it's complicated, but the good news is that we've done a bunch of these. And so for us, it's easy. But, for somebody else to do it, it can be daunting, depending on, the experience that they have.
Yeah, I'm not doing it.
I'd love to teach you one of these days.
Yeah.
We'll want to learn it. You may not want to learn it.
No, thanks, man. That's way too much hard work for me.
Yeah.
No, thanks. But what makes this thing work? I mean, I'm very curious. Like, when did you open the first one? And now you're in 22 different locations, 8 states, roughly. How long has that taken, that holistic journey from start to finish?
So we started in 2009. With our first. And by the way, we probably built over 30 of these locations, but throughout the years, we probably sold about 8 or 9 of them to somebody else, or, shut them down. But no, the way it worked mainly is because we're small. We keep our costs down compared to the, much bigger hospitals where they have massive expenses. Our costs are low. We focus on maybe 3 service lines. We have the emergency room. We have the sort of like the outpatient, imaging and things like that. And we have the patient side, and that's it. Compared to like a much bigger hospital system where they have everything, they have oncology, they have, orthopedics, they have behavioral, they have OB/GYN, right? We just focus on 3. service line. And so that's how we're able to make it from a business standpoint. So from a business standpoint, we have a relatively high margin business, and then we have a very relatively low cost. And so that's basically it. We have relatively high revenue and low expense.
So who's buying these micro hospitals?
Well, right now, I guess if we do sell, then the people that would most likely buy it are the other bigger hospital systems. So, like for example, in Denver, I'm just using Denver because you're there, but in Denver, there's like 3 big hospital systems. And so if we build a micro hospital there, and for some reason we want to sell it, one of those systems will buy it. And do you know why? Because it's already built, it's already licensed, and for them to buy it is a lot cheaper and faster than them having to, build it themselves. And then not only that, they want to buy it because they didn't want their competition to buy it. Because the worst thing for them to not buy it is if their competition buy it. Because if their competition buy it, then they would basically use that as a referral source for their other hospitals, right? And so, but obviously we're not selling. But if we do need to sell, and as the hospital, then really the only other people that can use it are other hospital systems that can move into an existing facility and operate it right away. And in fact, we have the same game plan. We're actually looking at 3 other hospitals around the country that are already built, but that are in distress. And so we'll probably take it over and then run it ourselves, using our own internal system, and then maximizing the productivity.
Got it. So I've just Googled Nutex Health. You've raised over 2.4 billion. Is that correct?
Oh, no, well, honestly, we have never raised any capital before. It's all been self-funded from day one.
So, well, the Crunchbase clearly needs to get their data sorted out.
Yeah, no, we're public, so we have all kinds of information out there. So.
Okay, yeah. So it's interesting, right? So anyway, it says here total funding amount 2.4 billion. What is your what have you learned about funding? I know you said you were kind of like bootstrapped. I don't even know where to go now. Are you bootstrapped or not? Because literally it says post IPO equity Nutex Health. That's you, man. 2.4 billion. Anyway, so have you raised money? You haven't raised anything, hey?
Yeah, so we became public because we wanted as a vehicle for growth. And then we also wanted to use the public currency as a way to sort of like incentivize our doctors and our nurses, and give them sort of like skin in the game. But we did not become public to raise capital. So that's one difference with us, because we're making enough to fund ourselves. And so most companies, go public to raise capital. Well, we did it for a different reason. We did it for more of a strategic reason. And so in some ways, we're sort of like under the radar from that standpoint. And having said that, as a public company now, we will need to go out there and talk with investors and raise capital, because otherwise, our stock is going to be flat, right? But no, I think definitely we will start that roadshow. Because when we did we went public, we did it what's called via a reverse merger, where we didn't really have to go to the roadshow and talk with investors and talk with analysts. But the downside is you don't talk with investors, you don't talk with analysts, and so our stock is competing with like the 6,000 other stocks that are out there. And so the investors, they don't know what to look for, and if they don't know who you are, they're not going to buy. And so if they're not going to buy, then you're not going to have a lot of demand for that stock. So we're slowly going out there and changing that. But we have time, because right now the operations is very strong. It's just that we need to do a little bit more work to get our name out there and pound on our chest a little bit to let the investors know how great of a business of a company we are.
Mm-hmm. So just for our audience, you didn't do like VC, you went straight to IPO, is that correct?
Yeah, we identified a company that was already public,
right?
And then we worked with them, and so we basically took over something like 94% of the company.
I see.
Like that. Yeah, it's called reverse merger. where you identify a company that is already public that may or may not be in distress, that are not trading very well, and then you merge with them, and then on paper they acquire you, even though you would then become the majority shareholder of that company. So that's how we did it, and so we didn't have to go through talk with investment bankers or anything like that.
So
Which
that's
now yeah.
so that's why it's 2.4 billion.
Probably, yeah. So at valuation at that time was 2.4. That's right. That's right.
Okay.
And
All
that's
right.
probably how they got it. That's right.
That's really interesting. Hey, and how did that all come about? Were you, I suppose you don't wake up one morning and go, "Hey, let's reverse merge."
No. And basically, what happened was that we had an idea to become a public company, and like I said, you know, become public company for strategic reason. Use it as a basis to grow, so that we could scale, and then we could use it as a vehicle to basically bind and align everybody, our doctors and nurses, and give them sort of like that currency. And so after we did that, then obviously there's three ways to become a public company, right? First one is like the traditional IPO, where you file paperwork with the SEC and did all and talk with bankers, get an investment banker involved, get a lead bank, get an underwriter, all that stuff. Kind of complicated. So that we could have done that. I mean, it would have been very expensive and time consuming. And so that was one option. The second option is to do what's called a SPAC, reverse merger, or like a SPAC, mergers, where you identify like a public shell, and then you reverse into that. The downside with that is that you have a bunch of investors that basically dilute your company, because they have a lot of money that are they want to dilute you. Third way to do it is what we did, reverse merger, which we just identify a shell, and then you and the shell just need to agree on the price, and you combine the company and you become a public company. So we decided to do the third way. The benefit of doing the reverse merger is that obviously it's relatively quick and fast, and you don't have to have a lot of people agreeing to it. The downside is that, number one, you don't get any capital. You don't get any capital raise, because when we merged, we didn't have any capital. We didn't have any other investor except for the shell investors. But the other downside is, because we sort of like did it the back way, nobody knows about us. No bankers know about us. Nobody follows us. We don't have an analyst covering us. And so, that's sort of like the downside. But it was the quickest way to become a public company. And honestly, looking back, it was the right way it was the right thing to do for us.
Very, very interesting. I'm always fascinated by the way startup, well, companies raise money or not, or become liquid. You know what I mean?
Yeah.
It's fascinating. It's like, I love America. I mean, I love America because it's so capitalistic. It's like the things you can do here. It's like, you'll know, you and I are like kindred spirits in the sense of like, came from emerging markets, landed in the US, and it's like now
Right.
it's like the land of opportunity, right? And I was talking to a couple of my American buddies yesterday over coffee, and we were talking about, because I'm talking to a lot of investors, and I'm getting into this interesting space where I'm almost the intermediary between companies and investors. Anyway, conversation for another time. But we were talking about different structures and the legal structures or the financial instruments and assets that you can use to create leverage. You know what I mean? It's the definition of what a venture capitalist does. You know what I mean? It makes money out of nothing, so to
No,
speak.
yeah. No, you're right. I mean, America is the best country, and both of us are immigrants, right? And so we're just taking advantage of what America has to offer. And if you have the will, you could do it. And it sounds like you're doing great for yourself. But the point is that, yes, there's just a lot of ways to do it. I mean, our way is just one way to do it, but there's a lot of different ways to become successful.
So, so two things on this. How do you believe in the American dream, like as an immigrant?
Of course, of
Mm.
course, I 100% believe in it.
Yeah.
The dream still exists. A lot of people are saying that the dream's harder to achieve, which they may be right. Who knows? But no, 100%, 100% believe in it.
Me too. I'm a total believer. I was talking
Yeah.
to a friend of mine this morning because I mean, like now it's just like the whole of America has been built on that idea, right? The American dream, the Italians, the Jews in New York, like
Yeah.
and all the other immigrants. And in fact, like it's a funny story. When we moved to Denver, we were looking at houses, and let's just say we looked at 10 houses to let, and I shit you not, Tom, 9 on average, I would say probably like 90% of houses to let were owned by immigrants. It's
Right.
crazy. It's amazing. And then even on this show, like I would say probably 70%, maybe higher, are immigrant founders.
Right.
It's madness. It's crazy. So it is
Yeah,
absolutely true.
I believe it. You
Yeah.
know why? You know why that is?
Uh-uh.
Because they have to. They have to do that.
Mm.
Because I can tell you that my kids, they probably won't follow the same footsteps as me because they grew up with a different mindset. They grew up with, sort of like everything sort of like given to them. So they didn't really have that struggle or even the chip on the shoulder to succeed. Whereas we had to fight our way. And, I like to think of myself as a kid that came from the streets. I'm sure you did too. And that's a compliment, by the way. Coming from the streets and have to learn the hard way and make a bunch of mistakes and get punched in the face and then get back up again. So that's sort of like where the way I think. But my kids, maybe even your kids also, they may not have that that drive or that hunger to succeed, right? And so to me, being an immigrant is sort of like the best thing that's ever happened. Again, it forced me to you know reach new heights and and create new things. Whereas if I was maybe second or third generation, I definitely would never have that sort of like need or that will to succeed. I don't know if that makes sense or not, but but that's basically what I see. And they say that success basically evaporates by the third generation, and I do believe that. And so maybe my kid will be okay, but my grandkids and future grandkids, they're probably going to be like nobodies. They'll be like the normal average American. So
Yeah, well, if you get them to listen to the Matt Brown show, I think that'll change quite quickly.
more change. That's right. That's right. Yeah, everybody needs to listen to the Matt Brown show. That's right.
Yeah, I think the thing is, like it's funny. I've been really blessed to have like billionaires on the show, and just really remarkable people. New York Times bestselling authors, Navy SEALs,
Congratulations.
Olympians, like, and
Yeah.
and I know like I've asked a few of them, and then I actually stopped asking them because the question was like, do you see yourself as successful? And eventually the answers was so one sided. I just stopped asking that question because no one sees themselves as successful. Do you know what I mean? What
Yeah,
is
I know.
su-
100%.
you don't? I know you the same, right? You don't see, even though like you've done what you've done, you don't see yourself, yes or no, as successful, right?
Yeah, no, I don't because to me it was just normal. What I do is just normal, like that, like something that I have to do,
Yes.
and to get to this point. You know what I mean? It's not like to me, it's not like work or anything like that. It's just I just have to. It's just like the passion that I have. So
Yeah.
I don't see successful at all. It's just it's just like a run, like going to work and it's a regular everyday thing.
So, what does success mean for you now? If you
Well,
don't, if you don't see yourself as successful, what is success?
I think success is more than just, what you're worth, how much money you make. To me, success is being able to do what you want to do. That's success. You're not tied to a desk I mean, or if you want to, be tied to a desk, you can, but that means that you're successful, right? So to me, it's just a freedom to do whatever you want to do. If you want to travel and not work, to me, that's success. Right. And so to me, sometimes I do envy so like the guy that just, could take off 3 months and just travel through Europe without a care in the world. He may be worth, I mean, he may have, $100 in the bank, but he's got that freedom to do whatever he wants to do. Right. And to me, that guy, that's a successful guy, not the billionaire who's stuck in a boardroom day by day, getting stressed over, this and that. You know what I mean?
I do.
So it's just a different sort of like mentality. So
Yeah, I think success is like it's not a destination, it's the process. Like you have to find success in every day. You know what I'm
That's right.
saying? Like, because if you add up all the days, it's like, you know, I don't know if you've heard that saying, but it's like trust is earned in drops but lost in buckets. So it's the same idea with success. It's earned in tiny drops. You know what I'm saying? But
Right.
if you make the wrong decision, you know, if you fuck up, like you can put it in, you know, like you can lose all of that success. You know what I mean? Like you did the wrong reverse merger. You know what I mean?
Right. No, I hear you. It's very brutal. I mean, I've heard it. I've heard of people who become quote very successful and then they lost everything, but then they
Mm.
build it back up again, right? And so yeah, there's a lot of it's all in the eye of the beholder,
So
100%.
So I've got a this. I met this guy yesterday. His name's Evan. He's probably listening to this, but he was telling his one of his relatives is like legit a billionaire. And Evan was working in like, you know, corporate banking, whatever. And then 2008 happened, couldn't find any work. And so his dad was like, yo, like get in touch with this guy. And, you know, anyway, so he meets him and he's like, and he basically, this billionaire says to him, look, do you want to be like wealthy or do you want to be very wealthy? So he's like, well, okay, well, very wealthy. I mean, I don't know. So he says, cool. So then he gave him this thing. He's like, cool. So I want you to think like create a lemonade stand that makes $10,000, and I want you to go away and think about how you're going to do that. And it was probably like an intellectual, you know, exercise he wanted him to do. So he goes away, he spends like 7 hours doing this whole thing, and he writes out like this business plan, and you know, with eventually they're going to like, you know, grow the lemons and da da da, and you know, proper business plan, you know. And so then he meets with this billionaire again, and the billionaire says, right, so before you tell me what you've came up with, I want you to know that everything you've thought about is wrong. So then, long story short, so he tells him everything, and he's like, no, no, no. He said the thing, and anyway, there's a lot of context there and nuance, but where it landed was his lesson was, you know, you haven't bothered to ask any questions. You
Right.
know, you know what I'm saying? Like
Right.
you haven't bothered to really ask and find out what the problem is that you're trying
Right.
to solve or what have you. And it was an interesting thing because this, he also said to him, he said, you know, most entrepreneurs, like, you know, they broke, most of them, like they're doing okay. You know what I'm saying? Like that, they're not at that level yet. So what happens is it's like, you know, you're operating at, let's just say, a 3 in net worth for a long time, like 25, 30 years. And then, I mean, it's not, I'm saying for most of us, right? Not for everybody. And then you have this liquidity event, and sometimes it happens in your 20s, sometimes it happens when you're in your 50s. But when you have it, that's when you become rich. And wealth is not about the money in the bank. It's about, to your point about your friend, like that travels around and stuff. Like it's how you get to spend your time.
That's right.
That's what true wealth is.
Yeah, no, we're 100% on the same page. 100% on the same page.
Yeah, it's very interesting. So tell me, Tom, where are you? What's the ultimate difference you hope to make here? I mean, you've done a reverse merger, 2.4 billion valuation, what have you. You're projecting to open up another 20 hospitals by the end of 2024. Like, where's this all going? Like, what's the ultimate contribution you feel like you want to make?
Well, I mean, I think we're fortunate enough to pretty much be doing okay. And so, right now we're just going to continue to grow because we're still getting so much demand from, folks around the country that we just continue to grow, continue to grow the model, continue to bring value to not just the patient, but the physicians, the community, so on and so forth. So we're just going to continue to go until we can't grow anymore. And right now I'm relatively young, and I love doing what I'm doing, and I'm just going to continue to do it until I don't like it anymore. And so when I start hating my job, then that's when I quit. But for now, I don't see any stopping right now at this point. So
Hmm.
I would say probably at least 10 more years. I mean, I hate to put a number in there, but we just continue to grow until we can't grow anymore, or we hate what we're doing.
So on that, what do you think you would miss the most if you were not doing what you do right now?
I think just dealing with people would be probably the least stressful. I mean, dealing with people will be what I miss the most. Dealing with our great employees, our physician investors, our physician partners. It's just fun dealing with people and talking to people and sort of like showing them our vision and get alignment, and things like that. If and when I stop doing this, my guess, and same with you, Matt. I mean, I don't see you ever slow down, right? But you may just do something different. And if for some reason the Matt Brown show isn't around anymore, I'm sure you're gonna have something else just as successful, right? But the point is that it's all about the people. It's all about dealing with people and making sure that they're taken care of, and making sure that they're happy and content in their lives. And to me that gives a lot of satisfaction, actually.
Well, I think the
Because
thing
we do lives, not just the patient lives, but also our physician investor, our nurses, and things like that. And that to me is probably the most, success. It's the most, gratifying part.
Yeah, exactly. And I think that what I love about what you're doing, I love this idea of like, the purpose of an entrepreneur is not to live forever, but it's to build things that can. And what you're doing is one of those things. I would also say that the Matt Brown show is a similar thing. You know what I mean? Like, let's just say, God forbid, anything happened to me. Like, it would be pretty much impossible to pull the Matt Brown show down from the internet. It's like it's in too many places. You know what I mean?
Right.
So, and let's just say like that happened. My kids, when they were in their 20s, they wanted to figure out what dad was about. Like, they would be able to go to YouTube. You know what I mean?
Right.
And see what it was about. It's about
Right.
legacy, and building things that really do last the test of time.
Right. Yeah. No.
So
No. It's posterity. It's posterity. It's leaving a legacy, like you said.
exactly. So let's two questions, Tom, and then we'll wrap up. One is, if I gave you the keys to the Matt Brown Show time machine, and you could go back to like day one, right? Zero micro hospitals. What advice would you give yourself about building NUTX Health?
Well, I think the first advice is choose the people you want to hang around with wisely. Uh, you know, uh, you want to choose the right people that's gonna grow, and that's not gonna, drag you down. That's number one. You choose wisely the people, because if you choose wrong and make a mistake, that's like a 2 3 year commitment that you have to get out of. So that's the first. To me, that's the first thing. Once again, it's all about people, and choosing the right people to partner with and work with is very, very important. Now, unfortunately, sometimes you can't tell. Sometimes people turn out differently, and they work what you expect. And so, I mean, that's just part of life. But if you can, choose the right people to partner with. Number two is have fun. No matter what you do, have fun, right? Because life is not worth it if you're miserable all the time. And so, even if you, once again, going back to that billionaire that's stuck in his boardroom every day and worrying about this and that, he's rich, but so what? It's not fun. He's probably going to die, early, right? Whereas that guy that's traveling the world, you know, he's got no care in the world. He's gonna survive much longer than that billionaire, as an example. So the point is, have a lot of fun, um, be grateful, and try to help those around you, and always give, because my opinion is that you make more when you give and you share. If you don't share, if you don't give, then it's not worth it. So you got to share and you have to give. And if you do those two things, then you're most likely going to be more successful than some of the other guys.
So I do the show, dude. Like, I 100% agree with you. So, but listen, Tom, thank you so much for being on the show, man. It's been great to have you here, and here's to your legacy, and I hope you get what everything that you hope for.
Likewise, Matt, and congratulations on all your success. And I hope the show continues to be a smash
Thanks,
going
Tom.
forward.
Thanks, Tom. Thanks, everybody. Ciao, ciao.
Bye. Thank you.